to End Childhood Sexual Violence, which is co-led by SVRI, Together for Girls, and the We Protect Global Alliance. And I'm just so happy to welcome you to today's virtual dialogue, from evidence gaps to action, exploring how to prevent childhood sexual violence by expanding our understanding of perpetration. While we know that victim survivor-centered approaches are really the bedrock of our field, we are here today because we also know that effective prevention also requires us to examine how and why child sexual abuse is perpetrated. During this session, we will examine harmful sexual behavior among adolescents as it manifests across offline, online, and also blended environments. Because we believe that by bridging these evidence gaps, we can build out more effective prevention strategies that are specifically tailored for low and middle income countries. As you probably saw in the description, this session builds on the shared research agenda on child sexual violence in LMICs, which was led by SVRI and funded by the Oak Foundation. But it was also a super collaborative initiative that engaged over 300 stakeholders to identify and really hone in on the most urgent evidence gaps in our field. Then we also know that we work best when we join forces. So we are so proud to be co-leading, co-organizing, co-hosting, and co-creating this session alongside SVRI, the Moore Center on Preventing Child Sexual Abuse at Johns Hopkins University, and the UNICEF Office of Strategy and Evidence, Innocenti. Our agenda today is designed to move from evidence to action. So yes, you'll hear about the gaps, but also about solutions, about emerging evidence, and also best practice. So first, we will highlight priority research gaps from the shared agenda that I just mentioned. Then we will hear about emerging research on perpetration and see how promising case studies are coming in from Brazil, India, and the Philippines. And then we'll dive into the complexities of this work. This is incredibly nuanced work, as you can imagine, and we will briefly touch on the ethical, the social, and the legal implications of working with young people at risk of causing harm. And finally, we hope to foster collaboration and more action. Our goal is to hopefully spark new thinking and also identify opportunities for future research, programming, and investment in this work. So my part here is very brief. So I'm just going to go through some quick housekeeping items to make sure we get the most out of our time together over the next hour and a half. Please introduce yourself in the chat and also state the country you're joining from. We received a very strong response to the webinar with close to 600 RSVPs. So it's really great to see such strong engagement. There will also be a dedicated Q&A segment at the end. But just to say, you don't have to wait till the very end to send us your questions. As they come up, as you're engaging with content, please put it in the Q&A box and we'll get to as many as we can towards the end. The session is also being recorded and live captions are available. So I think if you want to click on show captions on your Zoom toolbar, you should be able to view kind of real-time subtitles as we go through the webinar. And now, just to lead us through our agenda to facilitate our time together and also to introduce our first speakers, it is my pleasure to hand over to our moderator for the day, Alessandra Guides, who's a Gender and Development Manager at UNICEF Office of Strategy and Evidence in Innocenti, where she works at the intersection of evidence and actionable policy to protect children's rights globally. But also, along with everyone on this call, somebody that I've admired, learned from, and worked with and known for a while now. So, Alessandra, I'm turning over to you.
Super. Thank you so much, Nicholas, and right back at you in terms of the admiration. I also have the privilege of serving as the co-chair of the SVRI Leadership Council, a role that I'm very, very proud of. So thank you again for joining. It's always so exciting to see, we've got Germany, we've got South Africa, Nigeria, Italy. So it's always great when we see your names and countries popping up. So it is my absolute pleasure now to introduce you to Joanne Njagi. Joanne is a researcher at the Sexual Violence Research Initiative, where she leads the child sexual violence research work. And Joanne has over 15 years of experience working on issues affecting both children and young people. And recently, she co-led the development of the research agenda that Nicholas mentioned for childhood sexual violence prevention in low and middle income countries. And that's what Joanne is going to tell us a little bit about. Over to you, Joanne. Thank you so much.
Thank you. Hello, everyone. Thank you for joining us. And thank you so much, Alessandra, for the introduction. So as Alessandra has shared, today I'll be sharing insights from the shared research agenda on child sexual violence in low and middle income countries, which will really help us in framing the discussion on why perpetration matters and why we are focusing on harmful sexual behaviors in children and adolescents. So just to give a brief overview of the shared research agenda, the shared research agenda on child sexual violence in low and middle income countries was developed in response to 3 key challenges in the field. The first being lack of a cohesive evidence base with significant methodological, knowledge, and ethical gaps. Second, a bias towards research from high-income countries. And third, the absence of an intersectional approach, as most research agenda are often set by few voices. To address this, we used a collaborative, inclusive priority setting process, and we did this together with our partners, Together for Girls, We Protect Global Alliance, the Brave Movement, and the Safe Futures Hub, together with SVRI, to develop a collaborative, inclusive priority setting process that engaged more than 300 stakeholders, including researchers, practitioners, advocates, survivors, children and youth, and groups that are often excluded from agenda setting processes. And we had a remarkable representation from low and middle income countries with more than 70% representation from these regions. So we used CHINRI, which is the Child Health Nutrition Research Initiative. This is a methodology for systematic priority setting. And using this method, we did an adaptation that involved incorporation of qualitative approaches to ensure that the process was inclusive. And we also did some methodological adaptations to enhance completion. So through these adaptations, we identified priority research questions across 5 domains, which is understanding CSV, CSV prevention, CSV response, CSV among vulnerable and marginalized populations, and CSV measures and methods. And the agenda serves several purposes. One, it helps to identify evidence gaps. It also informs research planning and fundraising. It also serves an advocacy tool and as a tool to monitor progress when it comes to generating evidence on childhood sexual violence. And it also serves as a guide for grant making and investment decisions. So today, because our focus is on CSV perpetration, I will narrow down to what the agenda says, specifically when it comes to CSV perpetration. And I will briefly highlight several priorities from the agenda that are particularly relevant to today's focus on perpetration and harmful sexual behaviors. So within the domains, some of the domains that I mentioned, I'll be highlighting this. The domain on understanding CSV, one of the top priorities centers on peer-to-peer perpetration. And it looks at peer-to-peer sexual violence among adolescents displaying harmful sexual behaviors, specifically understanding the prevalence and drivers of harmful sexual behaviors in adolescent relationships. And this really reflects a growing recognition that a substantial proportion of sexual harm occurs between peers, and that prevention must start early before patterns become entrenched and before harm escalates into adulthood. And closely linked to this is the priority on identifying the risk and protective factors that shape perpetration and building strong evidence based on what works to prevent perpetration. So this domain also emphasizes the importance of developing and integrating effective perpetrator-focused interventions, not only to reduce risk and to prevent recurrence, but also to also embed approaches within broader systems-level prevention strategies in low and middle income contexts. And together, these priorities are foundational for perpetration prevention. They seek to understand pathways into harmful sexual behavior, identify opportunities for early intervention, and design more effective prevention responses. So I would also like to discuss a few priorities that are not just perpetration focused, but are closely linked to the perpetration focused priorities. And the agenda highlights several of these areas that are essential for understanding and preventing harmful sexual behavior. For instance, the agenda emphasizes the role of social and gender norms, recognizing that perpetration is shaped not only by individual behavior, but by families, communities, institutions, and broader systems of power and inequality. And that is why identifying effective social norms interventions is critical for sustainable prevention. The agenda also draws attention to marginalized and vulnerable populations and the need to adapt prevention and response interventions to different groups of children and youth, and also address barriers to disclosure and access to services, particularly for children and youth who are often vulnerable or marginalized. And finally, the agenda highlights the challenge of underreporting and calls for stronger measurement approaches, including alternative data collection strategies and proxy outcomes to better assess whether perpetration prevention interventions are truly working, particularly in low resource settings. So why does this matter? What does this research agenda demonstrate? So it demonstrates that the field already recognizes perpetration and harmful sexual behaviors as central and not peripheral to effective prevention. But it also highlights how limited the evidence remains, particularly in low and middle income countries, and how urgently we need better data, stronger theory, and more rigorously tested interventions that are contextually grounded and ethically sound. And this is exactly what today's webinar aims to advance by combining evidence on prevalence and risk factors, practical case studies from low and middle income contexts, and practitioner and researcher perspectives on what prevention can look like in practice. And I'll now hand it over back to Alessandra to invite the next speaker. And we will also share the resources on the research agenda that I have shared on. Thank you so much.
Thank you, Joanne, so much. And some of you may be aware that the Sexual Violence Research Initiative has led and co-led different research agenda, different exercises for various aspects of the work on violence prevention, including violence against children and violence against women, including one that looks at the intersections of these forms of violence, which was co-led with WHO and UNICEF. So I invite you to look at those. So now it's my also absolute pleasure to introduce you to Elizabeth Letourneau. Elizabeth is the Moore Family Professor in the Department of Mental Health at Johns Hopkins University, which is based in Baltimore, Maryland. She has over 38 years of experience leading a program of research, policy, and practice efforts aimed at preventing the sexual abuse of children. And then in 2012, she launched Moore, which is a center that focuses specifically on childhood sexual abuse prevention. And Elizabeth is going to provide us with an overview of the evidence on perpetration, focusing on the prevalence of perpetration, risk and protective factors, as well as prevention research as we know it today. Thank you so much, Elizabeth. Over to you.
Thank you, Alessandra and Joanne and Nicholas and everyone that's involved in today's webinar, and welcome to everyone. I'm going to take a moment to share my screen, and I need to know if folks are able now to see these slides.
We can, yes.
Okay, great. Excellent. Thank you, Alessandra, for that wonderful introduction. And I want to point out that we have a couple of QR codes that lead to our Moore website and also to our prevention.global website, which I'll be discussing today. So for today, let's see. For the next few minutes, I want to give an update on the state of the science of child sexual abuse perpetration prevention, and recognizing, as Joanne mentioned, that it can be uncomfortable to think about working with people at risk of offending sexually against children. That is not where most of us began our careers. But without addressing perpetration, we will never eliminate victimization. My hope is that each of you will come away from today's event with an understanding that perpetration prevention is as essential, again, as Joanne mentioned, as prevention efforts that target potential victimization, bystanders and upstanders, the built environment, the digital environment, and the whole of society. In just the past few years, there have been dramatic increases in efforts to establish international estimates of both victimization and, separately, perpetration prevalence, in efforts to design, evaluate, adapt, and scale perpetration prevention strategies, and in particular in efforts to prevent and address the onset of harmful sexual behavior or problem sexual behavior by youth. Many of the latest developments, by no means all, but many of the latest developments in our field have been supported supported by an Oak Foundation-funded program of work that we call Prevention Global, and that is led by my colleague Michael Cito and me and our teams at Moore and at his organization, The Royal, in Ottawa, Canada. Prevention Global has several aims. I'm going to focus my comments today on the first two of these: establishing perpetration prevalence estimates and identifying, assessing, and evaluating promising perpetration prevention programs. There are many reasons why we need to understand the prevalence, the scope of perpetration, to understand who is offending, under what contexts, in what conditions. It is important for targeting prevention efforts at the right times, at the right settings, and at the right people, but also because the crime of child sexual violence becomes much less easy to ignore if you can show policymakers just how prevalent this crime is in your country. So my Prevention Global colleagues and I developed surveys to assess the scope of online and offline child sexual abuse and exploitation perpetration. We now lead or support, in collaboration with other colleagues, prevalence studies in 5 countries: Brazil, Germany, Spain, the United States, and Tanzania. The Tanzania data have been collected in collaboration with the Center for Disease Control and Prevention Violence Against Children survey team. We're very excited to have just received those data and to begin analyzing them soon. We also have colleagues seeking funding to establish prevalence rates in Canada, Colombia, Czech Republic, Norway, Poland, Romania, and Slovakia, and we hope to establish baseline perpetration prevalence estimates across the globe. And then to be able to monitor these rates for change over time as nations begin to implement broad prevention policies and practices. Again, we feel like this is an absolutely necessary component of really getting policymakers' attention and pushing them into action against child sexual violence. The second aim of Prevention Global was to identify and evaluate promising perpetration prevention programs. And when Michael Cito and I first started out, we started this program back in 2021, we identified dozens of new emerging perpetration prevention programs. We were really surprised at how many were already out there. And we looked at these in terms of their promise, their scalability, their focus on known or suspected risk and protective factors. And we identified several to further evaluate, again, in collaboration with the developers of these prevention programs. One thing that became very clear very early on is that most perpetration prevention programs target adults. And that's important, of course. However, our prevalence research and that of others documents that much, and in some countries, most sexual offending against children is by children under the age of 18 or by very young adults under the age of 25. So one of the lessons from Prevention Global is the need for youth-focused prevention programs that address the risks of emerging adolescents, young teens, and young adults. Fortunately, there are several such programs. And before I talk about any of these programs, I do want to mention what are some of the risk factors that might lead to problem sexual behavior or harmful sexual behavior by young people against children. And there are many. All of you will be familiar with pedophilia or pedophilic disorder, sexual attraction to children. And a small percentage of adolescents and young people do have sexual attraction to children. Many of them seek help to avoid acting on that attraction, but that is one risk factor. It is, however, a relatively uncommon risk factor. Much more common risk factors for young people engaging in harmful sexual behavior are things like ignorance. We do not do a very good job of teaching children the rules of sexual behavior, the norms of sexual behavior. So as 11 and 12 and 13-year-olds, as they are beginning to become sexual with other children, they're really on their own figuring this out. And it's when they're at high risk of making mistakes and bad decisions. So ignorance is one of the things we seek to address. Impulsivity, inadequate adult supervision, these are other risk factors. Another uncomfortable truth is that children who have been victimized are at increased risk for engaging in harmful sexual behaviors themselves because that is what has been modeled to them. So being victimized, first of all, most children who survive child sexual abuse do not go on to offend, but it is a risk factor. We've seen this from dozens and dozens of studies. And it doesn't turn them into pedophiles. Let me also be very clear. Being victimized does not create somebody with sexual attraction to children. It models for the child that this is something that's done to children. And so addressing that is also very important. Other risk factors include being exposed to developmentally inappropriate sexual content online as well as offline, but now, of course, increasingly online. And there's many other reasons. To address many of these, we can implement school-based primary prevention strategies. Responsible behavior with youth and children is one such strategy that was developed by my colleagues at Moore, and it targets children who are in 6th and 7th grades in the United States. That's kids who are 11, 12, 13, again, just at the cusp of them becoming sexual. And it provides very, very direct information about why we avoid engaging younger children in sexual behavior, which young teens don't know. They do not know that younger children are off limits. And what is consent? How do you give it? How do you get it? What does it look like? How do we avoid engaging peers in non-consenting sexual behaviors? And then, of course, we also teach about child sexual violence by adults against children. Responsible behavior with youth and children, RBYC, we tested it in a small randomized controlled trial here in Baltimore, where I'm zooming in from. But we're also adapting and testing it in Germany and the Philippines, and adapting it for Brazil and Mexico. And we're about to test a version of this that we developed for children with, or for teenagers with intellectual and developmental disabilities. One nice thing about RBYC and other school-based prevention programs is that this is a scalable strategy. It can leverage existing school infrastructure that is already present in every nation. Not to say that it's easy, to be clear, but it's possible. Another thing that we're very excited about is the emergence of specialized helplines for people who have questions or concerns about their own sexual thoughts, feelings, and behaviors. There are several of these. Many have operated for years. Some have even operated for decades. But what's really new are specialized helplines that are for young people, that are for children, teenagers, young adults who have these questions and concerns about their own sexual thoughts, feelings, and behaviors. The first of these was established by Stop It Now in the United States. It's called What's Okay. The second of these was established by the Lucy Faithfull Foundation in the UK. It's called Sure. We also have helplines geared towards young people established by Save the Children Denmark, by Stop It Now Netherlands, and even helplines that target adults. For example, the helpline at Talking for Change, which is in Canada, and the Stop It Now helpline, also run by the Lucy Faithfull Foundation in the UK. Even these adult-focused helplines do attract a large audience of young people and teenagers. The great thing about these helplines is that they can reach across countries, across, around the world, and they provide a free, anonymous, and confidential strategy for addressing emerging concerns. So one thing that we hope to be able to do in the future is to leverage existing helplines, traditional helplines that are usually victimization focused, to give them the tools and the skills and the knowledge to provide specialized services to young people that might call in with concerns about their own behavior, not just with what might be happening to them. And by leveraging these specialized helplines to support helplines that exist in over 130 countries, again, a very scalable resource. So with that, I want to invite you to visit our MORE homepage and also our prevention.global website to learn more. Please feel free to reach out to me. My email is here. And I believe now we do have some time for questions, and I will stop sharing. Thank you so much.
Thank you so much, Elizabeth. And it's fascinating to listen to both of you. And as someone who's been working on the violence prevention field for over 30 years now, I think it is so true that there's so little that's being done in terms of looking at perpetration, particularly looking at perpetration by children and young people. And I'm so grateful for the work that you're doing. I also resonate with the imperative of obtaining reliable estimates on the prevalence of perpetration. And we've seen historically for the fields of violence against women and violence against children, how much easier it is to obtain political attention and buy-in when we are able to demonstrate that these are not small problems, but that they're quite prevalent. So really appreciate your points, both of you. Before we go into a discussion about programs and hear a little bit more about country level experience, we do have an opportunity to ask Joanne and Elizabeth some questions and clarifications relating to their presentations. So I've seen multiple questions coming up. Some of them are directly related. Some of them perhaps would be better answered by colleagues from the country level, but let me skim through them now. There is a lot of interest in becoming involved in the work. A question from Raven Burton, and thank you, Elizabeth, for sharing your email, a request to bring this type of program to Eswatini in Africa. Let's see. Maybe
Delighted
this is something
to go into any country where we can find partners. So let me just say that.
That's great to hear. So it's great to have your email and these opportunities to connect directly. Maybe to both of you, there's a question from Kirti Manvi that goes, based on your experience, what prevention approaches have shown the most promise in addressing adolescent harmful sexual behavior in low and middle income countries? So maybe we can hear from either or both of you on that one as I skim the rest of the questions. Thank you.
Joanne, do you mind if I take an initial stab at this? We are really just beginning to see the emergence of perpetration prevention in low and middle income countries. So one point that I meant to make with the programs that we identified as part of Prevention Global is that all of them were developed in high-income countries, and all of them were originally tested in high-income countries. So there is a real need for programs developed by and for individuals in low and middle income countries. We are also working with many partners, including several of today's later speakers and panelists, to take programs that were developed and to determine if they can be adapted for a new region that is quite different from the one that they were developed in and for. I think we are seeing some very good success. Fortunately, developers now across the globe are developing programs with more of a intentionality for scalability. And so the online helplines, for example, the specialized helplines exist in high-income countries, but there are general victimization-focused helplines run by over 155 child helpline organizations in more than 130 countries. Almost all of those helplines are already addressing young people with attraction to children or with other risk factors, other questions or concerns about their behaviors. And so we think that is a very scalable model for bringing in some training from folks that have been doing this for 20 and 30 years and working with folks who, as I said, are already interacting with many of these young people.
Thanks so much, Elizabeth. Joanne, before we go on to another question, would you like to add anything to the response by Elizabeth?
Not really, but I could add something based on some of the other questions that I see online. For instance, the question on whether the number of child perpetrators is as a result of high reporting rates, but there is also evidence to suggest that there's still a lot of underreporting. There are still barriers to underreporting, and that was also something that was emerging from the CSV research agenda, that young people, children, they're not able to report because of stigmas and multiple level barriers that are different levels when it comes to reporting. So as much as we may think there's quite a bit of reporting going on, there's still also a lot of underreporting, both at the places where they're supposed to report, but also in research. And also the evidence, the research agenda indicated the need to develop measures or strengthen measures that actually strengthen reporting, both at the places where children and young people can report, but also when it comes to data collection. Maybe I'll continue to share the other responses as I look at the questions.
Thanks so much, Joanne. And maybe I can add to that, just reminding everyone that there is a difference between the prevalence estimates and the reporting levels, right? And so when we're talking about prevalence, in other words, the magnitude of the problem, that data tends to come from household surveys that are designed as much as possible to encourage disclosure. That's different than the levels of reporting that we may get at a health system or in the police, etc., which historically only capture a very small fraction of the whole of the population that's affected by the problem. So we will hear a little bit more from the Tanzania colleague in terms of the VAT surveys, and then perhaps we can talk a little bit more about that. I think I have time for one more question for each one of you. Elizabeth, there's a question about the methodology for perpetration research to establish prevalence and pattern. And I wonder if you can just briefly respond to that, please.
Well, you actually just did, Alessandra. So we use population surveys, population level surveys of general population members. So we don't focus on people arrested or charged or convicted with crimes. We don't focus on people already in treatment for perhaps pedophilic disorder or for other issues. We do general population surveys to get a sense of people who may have engaged in these behaviors. And then we also include risk and protective factors to determine why someone might engage in these behaviors, and again, under what conditions, and why somebody with risk factors does not engage in these behaviors and under what conditions those are. And those are, I think, the most, they give us the best sense of actual prevalence. If you design a survey that guarantees anonymity and confidentiality, people will disclose even very, very heavily stigmatized behaviors, such as perpetrating sexual violence against a child. Not everyone will disclose that, so we're not saying these surveys give us perfect prevalence estimates, but they do a much better job than if we relied on formally reported offenses.
Thank you so much, Elizabeth. I think we have time for one more question, Joanne. There is a question around how to get involved with such organizations, and I wonder whether you want to mention the SVRI specifically or any other question that has piqued your attention from the Q&A chat. Thank you. Over to you, Joanne.
Yes, I think it's possible to, and that's very good that people are interested in joining these initiatives. All of us, our organizations, welcome participation through different mechanisms in our initiatives. We also have survivor movements. Some of the organizations represented here are survivor movements. We have a survivor movement such as the Brave Movement, for instance, which encourages participation or involvement of survivors across the globe. So you can engage with us by writing to the different organizations that are here, either as an organization. As Elizabeth mentioned, we are very open and welcome to partnering with different organizations. The SVRI has a grant-making initiative, which is called that is made every year. And we welcome organizations that are advancing research in low and middle income countries to make their applications, to do this through partnership with other research institutions. And we also have the SVRI Forum, which is an opportunity for people who are working on violence against children, violence against women, to come and learn from others, share with others, and also share what they are doing with the other people in this sector.
Thank you so much. Sorry, please go ahead, Joanne.
No, I was just saying, in case anyone else wants to add how else we can, people can get involved, they're welcome.
Yes, and I think some of the other questions that have been raised, we will get to in the panel, and then we will have another Q&A at the end of the conversation. So this is not the only opportunity. I do want to say, since Joanne mentioned the SVRI forum, which is taking place in October of this year, that this is a forum that is fully abstract driven. In other words, the program is designed based on abstracts that are submitted, are reviewed by volunteers, and are accepted. And the deadline for abstract submission is coming up on January 30th. So maybe, Paula, if you can pop the chat for the abstract submission in the chat, that would be really helpful. So again, Elizabeth and Joanne, thank you so much. And maybe when we come back for the final Q&A, we can bring you back in case there are any additional questions that colleagues can think of. We're now going to shift gears a little bit, and we're going to switch to a panel style conversation. And our first two panelists are going to present slides, and our second two panelists are going to interact with us via questions and answers. And I'm going to start introducing our first panelist, who is from my home country, Brazil. So it's always nice to see someone from our home country in doing these events together. Sidney Filho is a professor at the Department of Psychology at the University of Tuiuti do Paraná in Brazil. And he focuses on data-driven research about child abuse and intimate partner violence to promote the protection and empowerment of women and children. Sidney, over to you. And I will thank all of the panelists for keeping to time so that we can ensure everyone has sufficient time to speak. And a fuller biography of Sidney and the other speakers is being put in the chat. Over to you, Sidney. Muito obrigada.
Thank you, Alessandra. It's always nice to be around everyone, especially you and Elizabeth, that have always been so nice to me and helped me out throughout my career. I'm going to share my slides with everyone. Let me know if it is working. Yes?
Yes.
Great. Thank you. So when we talk about child sexual abuse and prevention strategies, intervention strategies in Brazil, the first thing that we have to really think about is that Brazil is a connected country and children are very connected. So I always open up with this statement so people can understand that I think we are all in the same age range here. We had an online and an offline life. And children today, they do not have this barrier. Online and offline, they are the same thing for them. Right now in Brazil, the last data that we have available, 99% of our 17 years old, they have at least one social media account. And the online universe is very important to them, is where they have a lot of their activities and social lives. So I'll always open up when I'm talking about intervention and prevention, because many times we forget about this important part of children and adolescents' lives, and we just talk about the real world, because that's where we as adults, we live in. So to talk about Brazilian research, we always had a focus on survivors. And this was a political choice because we didn't have a lot of money, we didn't have a lot of research funding to work on it. And you're going to find, and this is something that is going to happen in the Global South. You're going to see a lot of the clinical psychology focused on the consequences of child sexual violence, but not really focused on prevention. And we have a ton of research. I added one from Professor Antonio. What have we done in the past 20 years? We do a lot of research saying child sexual abuse happens a lot, sexual violence happens a lot. They have a ton of bad consequences in the short and long run, but we do not engage a lot in prevention and intervention strategies. One thing that we do it really well in Brazil is how we increase notifications and increase reporting. This is something that we were able to do, creating hotlines, online services, and this is something that we actually have been doing really well in the past years. So when we talk about prevention strategies in Brazil, many times what we do talk about are school-based for dating violence. And in those dating violence programs, many of them have the sexual violence components. But we do not have a focus on perpetrators. They are part of the program, but they are not focused on perpetration per se. We just published a paper with some colleagues from the UK about how can we work with school-based, gender-based violence interventions that work in low and middle income countries. So we have this huge review of the literature. We were able to have papers from all over the world from low and middle income countries. And we use realistic synthesis to try to create a framework. And that's what we have in the paper, a framework on how you should design if you want to work more with perpetration, with survivors. What is your focus with the gender-based violence? At the same time, what we have, and I always cite Professor Sheila Murta from the University of Brasilia. She was the pioneer to work with sexual violence prevention in Brazil with adolescents and children, trying to prevent sexual violence. And what she saw, and my own interventions made it, we were able with those interventions to reduce sexual violence perpetration by adolescents. But those are really small scale programs. And that's the whole point here. When we're talking about those programs, they usually face barriers of funding, of continuity, and they scale up. One thing that we're trying to do right now with some colleagues from all over the country is trying to understand the Brazilian parental perspectives on online safety. Because what we saw is that, oh, that behavior never happened offline, but online this did happen to me. No, nobody asked me to show body parts, but someone online in a chat told me to do that. And what we find is that the parents, they are very concerned about the stranger danger that we call this. So if someone that approaches my child online, they might see inappropriate content, which are very reasonable concerns. But the parents say I am not very literate in digital technologies. So it is very interesting because we interviewed the parents and the children separately. And the games and social media that the children use, the parents have no idea how they work. So they have a lot of hard time understanding who actually can talk to the children. And they want to know more about the awareness about behavioral problems. What is something that I should, this is a red flag of a behavioral problem if my child is being exposed online. What is very interesting is that the lack of knowledge about the social media and games create this kind of distance between policymakers, the parents, and the children. This week, I added those two screenshots. This week, the Brazilian government forbid the chat. Children cannot talk in the Roblox game anymore. So children made a protest online because they wanted to talk with their friends online. Because the government said we cannot allow just for the children to talk. Anyone can talk to the children. So the government said, let's ban the chat in this online universe. And children made these amazing posters. We want to chat. We are children, but we are human beings. They use songs from the dictatorship times in Brazil. So what we see is this really gap between what children want, what children think they are able to do online, and what parents know and how they are actually literate in online technologies. So right now, what we're trying to do is to follow a lot of Professor Elizabeth's path to engage in prevention that can scale up to the whole country. So we're using her experience to enhance our understanding of those strategies. At the same time, we got to understand that there are a lot of cultural, political challenges for us to engage. When you're talking about perpetration in the global south, many times what you're going to find is a political discourse. Well, we don't have a lot of money to fund everything, so why we're not funding survivors? They are the real victims here. So this is something that is very common that we have to address. and scholars and researchers, we have to do this political work as well to engage with policymakers, to actually engage with them to explain why is this important. So right now in Brazil, our next step is to culturally adapt to the RBYC. Our funding is under review for the moment, so fingers crossed we can start this year. So we can actually have an RBIC that touches all the important prevention points, but at the same time is connected to the Brazilian reality of highly connected children. This is one thing that I always joke with my American friends. What the American parents call it helicopter parenting. In Latin America, we call it parenting. So I think those cultural differences are very important for us to address so the program can actually be successful and effective so we can scale up in the long run. Thank you everyone for your attention. I'm open to questions. This is my lab Instagram account. I'm not very good at LinkedIn, so if you text message me in LinkedIn, I'm probably not going to see it, but we're very active on Instagram. Thank you very much.
Thank you so much, Sydney. And I think when you say you're not very active on LinkedIn, you're showing your age because I'm the same, not very active on. Clearly we should be. But really, thank you, and I really appreciate your points. Around the online offline continuum that we talk so much about, and there have been questions in the chat, and also about this really unhelpful competition about whether we should be funding work to prevent perpetration versus victimization. All of it is needed. And so I really appreciate those points. We will have a chance to ask you questions, but I'll come back to that after both panels. So it's now my pleasure to hand it over to Frederico Cabredo, who is a registered social worker and the country director for World Hope International in the Philippines. Frederico has over a decade of experience in child protection, and a key focus of his work is on preventing precisely online sexual abuse and exploitation of children. So we're really happy to have you join us, Frederico, to talk about the experience in the Philippines. Over to you. Thank you.
Thank you, Alessandra, and good evening, everyone from the Philippines. I'd like to share first my screen, and please let me know if it's...
We can see it, Federico, but I think you probably have to do the display mode because right now we're seeing all of the busyness around the slides. Perfect, that's it. Thank you.
All right, thank you. Once again, good evening from the Philippines. I am Fred Cabredo from World Hope International. Before I speak about prevention strategies, I'd just like to briefly ground us in what we mean by OSAIC, and you will be hearing this term across my talk. So OSAIC is online sexual abuse or exploitation of children. And in the Philippine context, OSAIC refers to situations in which children are sexually abused, exploited, or coerced through digital platforms, including live-streamed abuse, online grooming, sexual extortion, and the production or distribution of sexual images of children. What makes OSAIC particularly complex is that it is rarely only online. The harm usually originates in offline realities such as family stress, poverty, unsafe caregiving, weak protection systems, and limited digital literacy. The work that we do, therefore, treat OSAIC not just as a cybercrime, but as a family, community, and systems problem that manifests through technology. So why does it matters? Again, in the Philippine context, I'd like to stress out OSAIC is not just only a criminal justice issue. It is family, community, and systems issue. At the work that we do, we rarely encounter harm as an isolated event. Instead, we encounter environments where risk has accumulated over time, shaped by digital exposure, strained caregiving, neglect, poverty, and overstretched protection systems. From a practitioner standpoint, this shifts the central prevention question, which is not only how do we stop offenders, but also how do we prevent children and young people from ever moving forward or toward harmful behavior in the first place? Um, Now, what do we see on the ground? Across our casework and community engagement, we consistently see three realities. Um, Firstly, economic vulnerability shapes risk. Many of the families that we encounter are under intense financial pressure. And in some situations, this makes children more susceptible to grooming or exploitation. In others, it can draw entire households into harmful practices as a survival strategy. This means prevention cannot be detached from livelihoods, family stability, and social support. Second, digital exposure outpaces digital protection. Children often have access to the internet long before they have the skills or guidance or safeguards to navigate it safely. Many of the caregivers, parents are unfamiliar with online risk, making supervision difficult. So with our work, we treat digital safety as not a technical add-on, but is central to to child protection in today's context. Third, local protection systems are stretched. Community officials, social workers, schools, and local partners are deeply committed, but they are oftentimes overwhelmed. And early warning signs are frequently missed, not because of negligence, but because of capacity constraints. Um, the key lesson from this that we can share is harmful sexual behavior does not appear suddenly. It develops gradually when in environments where risk is unmanaged. Well, because of this reality, uh, our work again does not treat prevention as just a messaging problem alone. We see it as a systems design problem. And for us, effective prevention must align three layers: families where norms and behaviors are shaped, children and adolescents who navigate digital and social risk, uh, local protection systems which must detect, respond, and prevent escalation. When these layers are disconnected, prevention is weak. But when they are aligned, prevention becomes possible. So let me briefly describe how this plays out in World Hope's work in the Philippines. Um, Firstly, family-centered protection. We work not only with children, but with caregivers and household members. Our focus is on rebuilding safer relationships, clearer boundaries, healthier communications within families. We do this because we know that a child's long-term safety depends on the environment that they return to, not only on the services that they receive. And second, child digital safety and resilience. We also equip children and adolescents with practical skills like recognizing grooming, understanding consent, managing online risk, and knowing how to seek help. Uh, this is not a fear-based education, but it is empowerment-based prevention. And importantly, this also serves as a perpetration prevention function, because when young people understand harm and boundaries early, they are less likely to move toward harmful behavior themselves. Third, strengthening local systems. We work alongside social workers, schools, community leaders, and local government units to improve coordination and early detection. We translate lessons from real cases into community prevention strategies, helping partners recognize warning signs before harm escalates. In short, the work in our context is not only responding to harm, but we are also trying to reshape the conditions that allow the harm to develop. Um, a critical lesson from our work is that no single organization can prevent OSAIC or CSV alone. In the Philippines, meaningful prevention requires partnership across multiple sectors. You have local government units for policy and coordination, social welfare offices for case management, schools, law enforcement for accountability, CSOs, civil society organizations for community trust and outreach, and academic partners like Johns Hopkins and the Moore Center, which we currently have a project on RBYC as well. Um, so our role then is in World Hope is often to bridge these actors, translating frontline realities into system level action. Um, by having strong partnership, it allows us to share information responsibly, avoid duplication, intervene earlier, and sustain impact beyond individual projects. For practitioners, partnership is not just a strategy on paper, but it is also a condition under which prevention becomes possible, especially in LMIC settings. Um, Another central pillar of our approach is psychosocial support for survivors and their families. So, when a child has experienced online sexual exploitation, the harm does not stop with the incident itself. Families and children often carry the shame, fear, mistrust, and trauma. And if these are not addressed, risk remains high for the child, for their siblings, and sometimes even for other children in the community. So we see psychosocial interventions uh, as aimed to help children process trauma safely, rebuild their sense of dignity and agency, strengthen caregiver capacity to protect and support, and also restore healthier family relationships. Uh, we have learned that healing in itself is also a prevention strategy because when families heal, they are less likely to reproduce cycles of neglect, violence, or exploitation. Psychosocial care, therefore, is not an add-on to protection, but is central to preventing future harm. So, what does our practices teach us in the field? From our experience, there are three lessons that are especially relevant to this conversation on preventing harmful sexual behavior in young people. So first, prevention begins in families. If household remains economically fragile, emotionally restrained, and digitally unprepared, um, children often remain or will remain at risk. Second, digital safety is inseparable from child protection. We believe that any modern prevention agenda must also take online environments into account and seriously. Third, psychosocial recovery strengthens prevention. Supporting survivors and caregivers reduces the likelihood of repeated harm and intergenerational risk. So very quickly, what do we need from research and policy? To advance prevention in LMICs like the Philippines, practitioners need stronger collaboration with research and policy partners. We need evidence that reflects real family and community context, practical tools for frontline social workers or workers that they can realistically use, funding that prioritize early prevention and family strengthening, not only when crisis happens, and integrated models that combine protection, psychosocial care, and community system. Um, we believe that if we invest upstream in families, digital safety, and local systems, we can prevent harm before it ever begins. In closing, in the Philippines, World Hope's work shows that preventing harmful sexual behavior is not only about stopping offenders, it's also about building safer families, safer digital environments, and stronger local protection systems in partnership with communities, government, and researchers. So we believe that when all of these come together, children are safer, families are stronger, and cycles of harm can truly be broken. Um, so that's it for my presentation. Maraming salamat po. Thank you and good evening.
Thank you so much, Federico. And we are so appreciative. I know it's quite late in the Philippines at the moment, and we are so appreciative that you are up and with us. And I particularly take to heart your emphasis on the importance of the family environment, as well as your emphasis on the intergenerational aspects. And that's an area that I have worked a lot on, and the idea that by providing support and services, particular psychosocial and mental health supports to those who have been affected. That's also an intervention for preventing the intergenerational transmission of violence. So really appreciate you. I'm going to go to our next two speakers, and then we'll come back for a Q&A at the end. And I've put in the chat, but in case our panelists have not seen it, please go through the Q&A, the questions that we received, and select two questions that hope that you feel like answering at the end, because that will streamline our timing a little bit. So now it is my pleasure to introduce you. We're moving from the Philippines, Brazil, Philippines, and now Tanzania, to introduce you to Dr. Samuel Likindikoki. Hopefully I didn't make a horrible pronunciation there, who is a psychiatrist and a public health researcher and senior lecturer at Muhimbili University of Health and Allied Sciences in Tanzania. And his research addresses the intersections between mental health, infectious diseases, and violence prevention throughout the life course. And I'm going to go ahead and introduce Namrata. We're moving to India now. Namrata Joshi is a clinical psychologist and is a senior consultant at ARPAN with 12 years specializing in violence, trauma, and childhood sexual abuse. And Namrata leads ARPAN's Healing Intervention Program, where she weaves creative art interventions into work with both survivors and children engaging in sexual behaviors. So Samuel, if I could ask you to please put your camera on if your bandwidth allows for that. If not, no worries. And the way that this is going to go is I'm going to start with Samuel, ask you a question, and then move over to you, Namrata. And depending on time, we'll do a second round of questions. I hope that sounds okay. So Samuel, we would love to hear about the violence against children surveys, the VACs. And Elizabeth, you mentioned this in the beginning. It sounds like some data is just coming out, which is very exciting. And we would love to hear, Samuel, from you in terms of what those findings reveal about the prevalence, the patterns, and the key risk and protective factors for harmful sexual behaviors amongst both children and young people in Tanzania. Over to you, Samuel.
Thank you so much, Alessandra, and good evening, everyone from Tanzania. So I'm gonna go straight and talk about the VACs. The Violence Against Children survey are really instrumental tools for advocating child protection, especially in the low and middle income countries where we do not have a robust administrative data to understand issues around the extent of violence and possibly risk factors, protective factors, consequences, and the like. One of the major issues is the U.S. Has been the main funder for the VACs, and we are not sure moving forward if there will be more resources to be able to conduct violence against children survey. My understanding is several countries across the globe have been able to do the VACs. Most of them are in sub-Saharan Africa, and only 4 so far have been able to do the repeat VACs, in Tanzania included. So I'm going to share a little bit of experience from Tanzania because we conducted the repeat VACs. The data was collected in 2024, but the report was just submitted online for people, stakeholders to be able to get access to that. So in connection to what we are talking about today, the VACs always are not designed to measure harmful sexual behaviors directly, but broadly it measures violence against sexual violence that in a way includes harmful sexual behaviors, but it's a little bit harder from the main report to be able to disaggregate perpetration of violence for younger folks vis-a-vis for those who are younger. When you look at the overall structure of VACs, most often is survivor centered. So perpetration is one of the component, but is not is the way we look at the victimization. But there are some components for victimization, but not very much about perpetration. But the last fact that we did, actually were able to really measure some specific areas in the perpetration area. But before that, what I can say, when you look at the 4 vax repeat done in the in Africa, there's a good news. The trend is we've seen substantial reduction of different forms of violence, including sexual violence, which is a good news when it comes to prevention efforts done, for many years. But so far, we've seen, like sexual violence against female is still very high. Around 11% of female are reported being sexually violated, and around 5% of males reported being sexually violated. But again, what is really important that we're learning in relation to perpetration is that perpetrators, the vax actually elaborate about who perpetrate. And these are people, perpetration is usually done by peers, dating partners, adolescent, and the youth and children are a big portion of what have been documented as perpetrators. And this is really interesting because when it comes to intervention, we really need, as I think Elizabeth and other talked about, it's really important for us to know which age we need to provide what kind of program to be able to mitigate and prevent perpetration of violence. But also, the vax indicate where the location where violence is happening, and consistently, even when you look at the previous vax and the current vax, home setting is the place where violence is happening, and schools, and on the road between home and schools. So this is also very important because it provides some insight when it comes to formulation of program. We know how to design the program to target places where violence is occurring. And we also learned a little bit about disclosure, because a majority of participants in the recent vax, actually they never told anyone. More than half of female participants never disclosed experience of sexual violence. And about 80% of boys who experience violence, they never disclosed violence to anyone. This is really important because we're missing big chunk of children and youth who are going through some form of violence but no report. And when it comes to access to services, actually substantial, proportion of participants say they never received any help from the experience that from the violence that they experienced. And this also is really, really important when it comes to programming, to really understand that, a lot of children and youth who experience violence do not get services.
Thank you so much, Samuel. Thank you so much. We're going to move to Namrata now, just for the sake of time, but we so appreciate your emphasis on understanding the situation, not just the prevalence, but you mentioned the reporting rate or the help-seeking behavior. That's absolutely essential for us to be able to design policies and programs that respond to the needs of our communities. And it's heartbreaking, to see the defunding of the violence against children surveys, which have been such an incredible source of data on these issues. So thank you so much. Namrata, it's really a pleasure to have you here. And I know that for the sake of time, you've kindly offered to combine kind of two questions into one, and that's much appreciated. And again, our question to you is based obviously on your experience in India, working with children and youth who are displaying harmful sexual behaviors. What are the patterns and the trends that you've observed? And what are the practical approaches and interventions that have been most effective? And any lessons that you can share from your work, that would be super appreciated. Over to you, Namrata.
Thank you so much for having me. So there are, in terms of trends, I would speak first and then talk about the approaches and lessons that we've been able to gather so far. In school setups, we've seen that children engage in sexual misbehavior, sexual bullying, which is often frequent and normalized. So sexual name calling, sharing intimate images without consent, contacting each other for physical proximities are often taken sometimes as jokes or casual conversations rather than understood as harm, right? That's one aspect, one trend that we see. The second thing is in our work with the institutional setups, which is children who are in conflict with law and under legal system, we see typically two sets of categories. First is children who engage in sexual misbehavior. These are the children who engage in behavior because of the needs of gratification with an intent to gratify themselves. The second category that we see is children in consensual relationship. Now, when we talk about that, they are in the legal system because of the age of consent being 18 here in India. They engage in this behavior more out of curiosity, sexual attraction, and lack of knowledge around consent and boundaries and things like that. While in the school setups, we often see children engaging in this behavior, again, with limited knowledge, but more with an idea of humiliation. However, those children who really sexually offend, we've seen that they often have history of trauma themselves. So many of our fellow speakers have spoken about this earlier, right? That there's a complex history of victimization to perpetration, and not all children do perpetrate, right? However, the risk definitely increases, like it was spoken. When we talk about this, it's also important to understand the fluidity, right? That between of a survivor to perpetrator, and that happens if it remains unaddressed for a really long period of time. Simply because the way children understand boundaries, their bodies and intimacy is shaped by their experiences. So long exposure to abuse, trauma, exposure to violent content can really affect the way they operate, right? What we've also seen is that children often do not fully realize the impact of their actions until they reach the counseling session, or in the times when restorative approaches have been used and they understand the harm that has been caused on the other person, right? Now, talking about the approaches that have worked for us. First and the most important emphasis that I would like to place is on early intervention, right? On classroom-based strategies that have worked for us over the years. Arpan has been conducting a personal safety education program. We've almost done this with over 150,000 children. What this program basically entails is helping children be aware about safe and unsafe situations, providing them with skills to help them respect each other's boundaries, refuse unsafe situations, and of course, seek support in case of unsafe situation. We have seen that this primary strategy has worked amazing in preventing a harm before it occurs. Like, for example, we conducted an evaluation in 2004, understanding the impact of personal safety education program. So we had the 4-year gap between the intervention and the evaluation, where we interviewed 1,400 participants. Those were children and key stakeholders that we worked with. What we noticed was that about 90% of children had built agency to participate in their own safety. That means they were empowered to handle unsafe situations in future. What's also striking for us is that 93% of children after this program developed awareness on personal boundaries and recognized that sexual misbehavior, sexual bullying is an unsafe act. That's why prevention plays a significant role in perpetration prevention. The second important aspect that we've seen is restorative practices or dialogue spaces. Herein, we bring together children who have been harmed and those who have caused the harm. And sometimes they are accompanied by peers and adults in the community to help them understand the impact and also co-create repair systems, right? How can you bring about corrective behaviors to whatever has happened, right? So in our experience, like a 12-year-old happened to earlier consider his behavior as normal, after a few circles happened to understand that boundaries are his responsibility, and intention and action both are equally important. So spaces like restorative provide a very non-directive and safe approaches to the well-being of the children. Along with that, giving them an opportunity to really see what harm has been caused. When children are given lived experiences, stories like this, we have seen that the transformation can happen because they are able to see what impact has it left and have a space to own accountability and imply corrective measures on those behaviors. The third important thing, which I think so many people also emphasized, my fellow panelist has emphasized, is around integrating therapeutic approaches and integrating therapeutic work, right? We use trauma-focused cognitive behavior therapy, mindfulness-based work, arts-based therapy with children to inculcate about the changed behavior that can be far more safer for them, right? We've been working with institutions where children have been housed under conflict with law. And one of the key success metrics that we can take away from our therapeutic work is that our stakeholders interaction have significantly always showed that no child has come back to the system with any reported cases of recidivism. That means that the impact that therapeutic work can create in terms of repair and reduction in perpetration is significant. I'd also like to take a few minutes and talk about an evaluation study that we did, which 21
Namrata,
children.
sorry to interrupt, but maybe just if you could talk about that in 2-3 minutes at the most, so that we have some
Absolutely.
time for Q&A. Thank you.
Definitely. These 21 children showed impact in a way that, for example, out of 21, 16 children could distinguish what is safe and unsafe, while 12 children could not only identify sexual triggers, but also use strategies and skills that they have learned through counseling. What we do in counseling is combine an approach of individual as well as group sessions, simply because group settings often give children the space of collectivism, cohesiveness, and the feeling that I am not alone in this. It also shifts the perspective from denial and dismissiveness towards taking accountability in a safer space, right? The key lesson is to also work with caregivers. Empower them to understand, sensitize them towards the trauma, and give them skills and management tools to really work with these children. I would just end this with a short note that sexual harm, of course, needs to be addressed very clearly, but along with creating boundaries and empowering them through education, we also need to have spaces for repair and growth. Only punitive measures work like spaces in dark, whereas therapeutic interventions, early personal safety education programs often take them towards light, where the shift can happen from not being able to see what's been violated to taking accountability, understanding how this behavior has impacted others, as well as making a sustainable behavior change.
Thank you so much, Namrata, for all of that wisdom. And I've been following the work of your organization for a while, and I'm always so impressed by the numbers and by the complexity of the work. Thank you so much. Really appreciate it. I would like to invite all of the panelists to put their cameras back on if we can. And I'm going to try to do a round. I have asked you to identify a question that you may want to answer from the Q&A. And I would be grateful if you could do that as briefly as possible so that we have time to answer as many questions as possible, if that's okay. And I want to start with Sydney. Over to you. You picked a question.
Thank you, Alessandra. The two questions about low and middle income countries. So one is anonymous, so I don't know who's asking. About the increasing violence against children, we are not sure about any increase or decrease because we do not have a long time of data. We don't have longitudinal data in almost every low and middle income country. When you compare to the UK that has the NHS data since the 1800s, Brazil right now, we have 30 solid years of data, but the pandemic years were bad for our data. So it's very hard to say if there's an increase or decrease. What we do know is that there's a more awareness about child violence in general. So people are more willing to report, especially physical violence. So we have a lot of data supporting this in Latin America and in some African countries, but we cannot say there's an increase. I think people are more aware of child violence. So that's why they are reporting and they are more interested in the topic. And about how we can actually address harmful behaviors and interventions, we try to create those frameworks that you can apply to your own reality. Because if you look at Brazil, Argentina, South Africa, every major global South country, the disparities within the country are huge. So I live in a city that is called Curitiba, that has the Human Development Index of Belgium. If you drive 3 hours to the inner state here, you're going to find a Human Development Index of the Ivory Coast. So Brazil is a very different country. The kind of interventions that I'm going to do in my city are different than the ones that I'm helping some colleagues in inner state to build. So I think that's the most important thing for us to have something tailored for our needs, but that you can adapt to your reality. And just a final, I'm trying to be very brief, Alessandro. You know, Brazilians have a hard time doing that. About Steve's comments on about deaf or hard of hearing children, I think you're right in some level that we do not have a lot of data about disabilities in general. I think this is something that we all should work on it. Here in Brazil, what we're trying to do is to have the forensic interview protocols that are built into sign language. So I'm going to add 2 papers in the chat of our work in Mozambique and Brazil. We do not have a lot of prevention strategies yet for the public, but this is something that one of my students, Ana Rebecca, is going to try to work with the RBYC, building a sign language version in Brazil as well. So this is something that is we all must approach, and this is something that we're trying to work on it. I think that's it.
Thank you so much. Obrigada, Sydney. We're going to move over to the Philippines, and hopefully in the Philippines, they don't talk so much as we do in Brazil. So, Federico, over to you.
I'll try, Alessandra. Thank you. So there are 2 questions I would like to answer very quickly. First is from Esther. That how can we introduce digital safety program in a community where their culture does not permit children to discuss sensitive topics relating to sexual abuse? We actually, in our experience, we actually encountered several communities where this is happening. And from our experience, when working with community, we start by framing it in a child protection lens, uh, online well-being, and responsible technology use. And once it's there, we begin by engaging parents, community leaders, and others to build trust. Um, Also from Raven, how do you balance individual autonomy when engaging in social media, but also foster protection and literacy? And also, I'm again speaking from our experience. We balance autonomy and protection by accepting that social media is already part of children and young people's lives, everyday lives, and instead we focus on building skills rather than imposing bans. We promote digital literacy, critical thinking, and help-seeking behaviors, while also, as I mentioned a while ago, engaging caregivers and systems to provide safeguards. Okay.
Thank you so much, Federico. Really appreciate your responses. We're going to move over to Namrata.
Yes. I think there is one question on restorative justice, if I am looking at it rightly. So the model through which we work this through is first, it's important to first understand that not restorative justice models needs to be voluntary. So children need to be prepared first that there can be an interaction that's going to happen, and a lot of preparation with those who have harmed versus those who have been causing the harm needs to go in before you really bring the dialogue together with both of them. What we also do is after our dialogue has completed, we give them a gap of a few months before we check in again, just to ensure how has the change been sinking in, how has the understanding been, has the behavior reoccurred in our sense. And we also involve teachers if it is in a school setup, or staff and attendants in institutional setup. So far, we have not seen the behaviors reoccur, but one important emphasis is that the environment needs to use restorative languages very frequently with children. So if you are conducting restorative programs in schools, it's important that the teachers, the core stakeholders who are around children echo that and not attend to only punitive measures, because then that's going to do a lot of undoing for children in some sense that they've learned one behavior. However, the experience in the system has been very different. I hope that answers the question.
Thank you so much, Namrata. That's really appreciated. I'm now going to move over to Samuel in Tanzania. Samuel, is there any question that you would like to answer?
Broadly, maybe two things. Number one, from sub-Saharan Africa, we have evidence to indicate substantial reduction of all forms of violence measured in the VACs in the 4 countries that they've done the repeat VACs. I think that's just for information. And the last thing that I want to respond, there was a question around disability. So the Tanzania VACS was the very first VACS that was able to include a module on disability. So the metadata will be available for people to try to understand disability specific data in the Tanzania VACS. So people should look out for that if they want to understand more. It's not in the main report, but the metadata has variables on that. Thank you.
That's really an important message, Samuel. And those of you who have seen the latest issue of The Lancet may have seen that the cover of The Lancet has one single quote, which is intimate partner violence and violence against children are preventable. And that comes from a comment by our colleagues Rachel Jukes and Naima Abrams, sorry. And I think it's a really important message because sometimes we get lost in talking about the problem and we don't say it enough that these are forms of violence and human rights violations that are absolutely preventable. So I'm going to hand it over to Elizabeth and then Joanne. Over to you, Elizabeth.
Hi, everyone. Well, again, I am just beyond words with the number of people who attended and the breadth of countries represented here. I think what I want to end with is just some very positive notes. We are actually seeing some declines in violence perpetration by youth in some countries. I think we want to lean into these. We know that kids are learning more about appropriate behavior because of the work done by our colleagues at RPAN and Sydney and Fred. In so many countries, we are really beginning to see in so many countries, we're beginning to see prevention strategies being implemented. And in some countries, we do have some data in the United States and Australia to indicate some declines over time in some areas, which is, I think, very, very hopeful. We should all have a lot of hope. Child sexual abuse is preventable, not inevitable. And because of the folks on this call and our colleagues, I think we will get there. Thank you very much.
What a positive message. Thank you, Elizabeth. Over to you, Joanne.
Mine is also to reiterate what my colleagues have said. This is really overwhelming. The response has been overwhelming, and it's exciting to see so much interest, particularly in prevention. So for me, I have responded to some of the questions, particularly on the need for a holistic approach. That, it's important to, yes, have school-based interventions, but it's also important to go into the communities and engage with families, with communities, with leaders, with the justice systems in creating a holistic child protection system. But also the interest in what works, I think, is a call to action to all the people who are here working on different interventions, whether they be research-based, whether they be practice-based, to share these resources with us, because also as SVRI, we curate these resources on a weekly basis. So this would be a great opportunity for us to all share what we are learning and what we are doing with the other partners in this field. Thank you very much. Over to you, Alessandra.
Thank you so much, everyone. And we are 1 minute over time, and I did that intentionally so that we had more time for Q&A and less time for me. And I'm trying now to upload my key takeaways in the chat. And of course, I'm also showing my age because I can't manage to do it technologically. So if I manage it, you'll see it coming out. But really, the only thing I wanted to say is my heartfelt thanks to all of you for this conversation. I think it is long overdue that we start talking about perpetration. That does not mean that we are also not talking about prevention of victimization. These things need to go hand in hand. I do want to emphasize a couple of things. The online-offline continuum, we are seeing a little bit of a siloed approach to looking at online violence and offline violence, even though we've seen from the presentations that there's no distinction, particularly for children, of whether their lives are occurring online or not. So we need to respond to that. I also want to emphasize the importance of looking at the gender dimensions. Again, it's not about a competition of whether women or men, girls or boys. It's about looking at the data, understanding how these forms of violence affect different individuals and responding adequately. And then, of course, as someone who sits in UNICEF's Office of Evidence and Strategy, the importance of generating quality data and quality research, and the importance of ensuring, particularly at a moment in time when funding is so scarce, that our policies, our programs are guided by the evidence, and that we continue to monitor those interventions to ensure that A, we're contributing to the evidence base, and B, we are not resulting in any unintended harm, and we are achieving the outcomes that we set out to achieve. So thank you so much. There's been a wealth of resources shared in the chat. The SVRI will be sharing this recording with all of you who have registered. And I cannot thank you enough for not just your participation today, but all of the amazing work that you're doing so that together we can prevent violence against children, young people, and adults everywhere. Thank you so much.